Children with complex medical issues, depending on how severe they are, go through a lot of different stages. There are a lot of kids who are, when they are like 5 through 11, when they have been managing disease for a long time, they're very effective at it. And then when they enter their teen years, they kind of enter the normal developmental phase of being rebellious, and they rebel against their disease. And it's extremely difficult to work through that with them. And I don't have a quick answer for it. There's a lot of resources that the AAP have put out about strategies for doing it.
This is a real problem, and this is something that we face all the time, especially like with homeless populations. They have a lot of challenges in their lives, and they have a lot of priorities in their lives. And medical care is somewhere amongst those priorities, but it might not be the top priority. Finding immediate shelter, finding the next meal, these are all very important things also. The thing I think that as physicians it's helpful to remember is that people only do what they're ready, willing, and able to do. And you as a physician cannot dictate to the patient what they are ready, willing, and able to do. They have to decide that for themselves.
It's not appropriate to expect a 5-year-old to be able to manage their own asthma. It's not appropriate for a 5-year-old to be able to manage their own diabetes. So if the parent can't do that, there needs to be frank discussions with the parent about what they need to get their child there.
If your clinic has extra resources, like it has an intensive case manager, or an asthma health educator, or somebody, a nutritionist, to help them better navigate the problem, certainly utilize all those resources.
Things like home health aides, community health workers, social workers, therapists, people who can come into the home to help support the chronic illness. In places where resources are more limited, sometimes it's sitting down with a social worker and other providers to come up with alternative care plans that are going to fit into the family's life better. It's a lot more work for us as doctors, and sometimes we just can't do it. But I think taking the collaborative approach and trying to get different stakeholders motivated to think about a particular patient and their particular barriers to try to overcome them is the most effective, both for your own mental health and for the success of the child. Sometimes that can also involve getting untraditional people involved in the mix. A lot of times people come from different social networks, church groups, community groups that might be able to provide care. I think that parents are the best liaison for that, to say to a parent, is there someone from your church who might be able to help with this, or is there somebody from your family who might be able to help with this, and then offer for them to come to a visit, or to give them materials that they can share with this person to help the family broaden their network, something that they might not have thought about.
But if it's just you and the patient and there are no extra resources, you just do your best. You can suggest some things to the patient. And another good thing is to like check in with them and see, well, what do you think you might be able to do? To get an idea of what they think they're capable of and what they're willing to do and what they're able to do. So checking in with them is always a good idea. And then if they're willing to, you can bring them back for more frequent visits to help them and coach them further.